Actually, oops.
There we go. Okay. I'll turn it over to you now. Take it away.
Thank you, Erica. Thank you so much for having me tonight. As you mentioned, I'm Dr. Maria from Philadelphia Pediatric Dentistry. We're a small pediatric practice in the Art Museum neighborhood. And what you'll find from me is I have maybe an accidental focus on the younger child. It's really my joy space. And so out of that is where this conversation, a chat with a pediatric dentist before they get teeth, comes from, because I have found over the years, chatting on the playground, dropping little pieces of information, that families say, "Oh, wow, I wish I had known that sooner." And I'm like, yeah, I agree. Because I think that every parent does their best for their kid, and you can only do what you know. And so this is hopefully a sprinkling of fun facts, helpful hints. We call this anticipatory guidance on the provider side, that would make it a really successful, healthy first few years with your little ones. So before I get started, I usually like to have an idea of where you are on your journey. Am I speaking with families of newborns to toddlers? So I just get like in the chat, or take your mic off and just say like how old your little one, or the one that is on your mind that you're here for.
Go for it.
I'll go first. I'm expecting this week, so.
Congratulations. Enjoy the quiet.
Yes, that's what I've been told. So this is
really before they get teeth.
Yes, that's lovely. Oh, congratulations and lots of health. Okay, good. That's wonderful to keep in mind. Great. I have a note in the chat. 5-year-old, 2.5, and 1.5. You are outnumbered. Well played if they're all in bed already. Good job. Go ahead.
Hi. My son he's 2.5.
Beautiful. Wonderful. So you have encompassed the entire range of like my favorite in my practice. I have like a very young 6 and under practice. So this is how I spend my days. So I am going to start at the very beginning for Rachel, since you're expecting you're going to be hitting these things the next 3 months-ish. And I'm happy to answer more specific questions as they come up. I have taught dental students and residents in large lecture halls, and I got on the Zoom thing in the last year. So I am great with being interrupted. So you will not derail me. I really encourage it. I do these talks once to twice a month, and I have yet to repeat the same talk. And so I just want to make sure I'm really getting to what interests you. And I find every group has a different focus. So we'll go there. So before they have teeth start off, I like to give a little nod to some of the things that families come in worried about that I would like to normalize. And one of those things is oral habits. You are going to hear a lot of conversation, maybe a lot of noise about thumb sucking and pacifiers, or I mean, sometimes they suck other things like baby blankets. And I want to sort of stabilize this with, this serves a purpose. And it's an important thing in development. I like to explain it to families who are worried about it. It's like deep breathing for adults. Oral soothing is a skill. It is the child, that little one's ability to handle whatever is happening in the world around them and soothe themselves. And we all know how wonderful it is when we don't have to be the source of that soothing, when that child actually develops the skill. And they don't come out with that. They develop it over time. And then you see families who see a baby who's thumb sucking, which actually sometimes they do come out thumb sucking. Mine did. Or they take a pacifier and they come to me in the office and they go, "Oh, I know you're going to be upset. They're a thumb sucker." And I'm like, no, they're doing a great job. Let's just make sure it serves them. So if you are pre-contemplative on this, your baby's still in your tummy, and you're like, what am I going to do about this? What I encourage is, you are not going to be able to choose for your little one whether they're a thumb sucker or they're a pacifier. They're kind of typically gravitate, or they might not use one of those. They might have some other soother. But if they do, know that one, pacifiers do provide some protection against things like airway and breathing and SIDS that people talk about. So pacifiers are okay. And they're really helpful because they don't come attached to the baby. So you can leave them in the crib. And you can create over time that association that is a healthier relationship with the soother. Thumb sucking, you don't get to call it on that one. And the thing that I offer to families about thumb sucking is if you want your child to be able to stop, they have to have something as a backup plan for self-soothing. And so if you happen to have a thumb sucker as your little one, make sure that they are also a white noise baby, and they are also in possession of a favorite lovey, and they are also given a really routine, maybe not soothing is the word, but a routine for the bedtime, that you want to stack the associations up so that if the time came that the child wanted to be ready, or you were hoping to get the child ready to stop this oral habit, it's no longer serving you, that they have other skills in place. And that comes full circle to this whole, it's like deep breathing. You couldn't possibly expect me to handle the pandemic if I didn't already have in place the ability to soothe myself down. And 2020 took more than deep breathing. I needed deep breathing, I needed yoga, I needed meditation, I needed friends and phone calls, and I needed wine. So like our little ones need like multiples sometimes to get through those things. And bravo to us, like that is our job to teach them those things. So that's my pacifier thumb sucking. Why do we care? Why does the dentist talk about it? Because although it is very normal, developmentally appropriate, sometimes it hands off and starts causing something developmentally not ideal. And we call this a malocclusion. It's just the pacifier or the thumb can actually mold the teeth and the bones. And so that's why it's important to be mindful about this. Change what you can and partner with a great pediatric dentist to change what you can't. And we can work it out over time. So that's my little piece on pacifiers. And I hope you find that helpful and soothing as opposed to stressful. The second one that I like to talk about, and I promise I will eventually get to brushing and flossing. I am a dentist, it is in my wheelhouse, but I wanted to talk about a part of oral hygiene that I don't think gets enough attention. And so what I would like to suggest is that nasal hygiene is part of oral hygiene. And what I mean by that is that for our little ones to grow, for grown-ups even, we all need to breathe through our nose. We are meant to breathe through our nose. And sometimes we can't because we have a cold or we have allergies. Sometimes we can't because we're obstructed by tonsils, which are enormous. But fundamentally, our babies should be able to breathe through our nose. And infants, newborns in particular, they're obligate nasal breathers. They have to time their breathing with when they can even swallow their milk. And so it's really helpful that if we start seeing things creeping in that make it so that a baby starts mouth breathing or is struggling to breathe through their nose, we add nasal hygiene as part of their wellness routine. And all that means is when we're thinking about giving them their nightly bath and getting them clean, we also perhaps would add nasal saline spray, just the cheap stuff at CVS, no medicine in it, spray, and the nose Frida to clear the nasal passages, especially if you saw a little bit of mucus building up. It doesn't need to stay there, and you don't want it to become something annoying and obstructive and irritating. If you would have asked 10 years ago me, are you going to be sucking snot out of your child's nose? I would have laughed, but here we are. And it really, that nose Frida, I'm not like paid by them in any way, shape, or form, but it is such a gentle option. And you compare that to the bulb suckers that we were all raised on, and there's just a lot less trauma. So I encourage you to go out and join the bandwagon on that one and chuckle at yourself as you come in and suck snot. Something I apparently am very good at. So nasal saline, little spray drops. You don't have to neti pot your baby. I'm a neti potter myself. I use it myself, but I don't use it on my kids. We're not there yet. But I do see some people do it. I'm just not ready. So I hope that's a surprising and interesting one. I see a thumbs up, things we do for our children. So that's awesome. it's a good healthy habit. And what I like most is, wouldn't you like something that's not medicine that might prevent the need for actual medicine? And that's how I see that particular nasal hygiene fit in. Now, my third one for the before they have teeth is the process of getting teeth. So teething is a really interesting experience because babies can't say, "Oh, mama, that hurts," but they kind of do. I mean, they express their discomfort, and we slowly learn, or maybe quickly, learn these cues. But teething seems to be one that does not always connect the dots for families. And what I find is I'll see families coming in and saying, "Oh, the kiddo's super fussy, and we just don't really know what to do. We gave them Motrin once, or we gave them Tylenol once, and we gave them Mature, and it didn't work." And I'm like, well, because it still hurts, and it's pain. It really is pain. And I know this is pain, not because I can remember teething, because that would be unfortunate, but because I get emergency appointments from 6-year-olds, 12-year-olds, and 16-year-olds, because they're teething too. Those are the 6-year-old molars, the 12-year-old molars, and the wisdom teeth. And it hurts them so much, and they articulate it so well to their parents that they actually come in for an emergency dental appointment thinking they have a toothache. So teething hurts. And our little ones need us to know this and be able to treat that issue. So there are many things out there for teething, and they fall into 2 categories. There are ones that are for pain, cold, teethers, things to chew on, gnaw on, sort of worry against it, help push the tooth through. Pain medicine, Motrin, Tylenol. And then there are soothers. And so soothers are like the Camilla oil or the Highland teething tablets. They're not pain management, they're soothing. So if your instinct is that your little one needs to be soothed, that's the direction that you might choose to go. But if your instinct is, my child has pain, just be mindful and intentionally treat the pain. And so what I offer to families as far as an insight on this is, I know you don't want to give your child medicine around the clock. And so I suggest you plan during the heavy teething time to give the medicine at bedtime. Because I don't know if the rest of you have had a really long day momming it really hard and your backs hurt, but mine hurts because it's evening. And when we're tired, we perceive pain more and differently, and it's harder to manage. And that's the same with our babies. And so if you were to offer that pain medicine in the evening, they're more likely to sleep that evening, that night. And then you could help them through the day with the cold teethers and rubbing on the gums and all of those non-medicinal options, and feel less frustration and know that you're really addressing what you and baby both need. And teething, some kids are really great. Like they pop out teeth like nothing, and you're just like, how did you get those? And then some kid, it's every single tooth. And my baby was one of those, that my first baby. My second baby, she's like a wonder baby. She's trying to trick me into a third. Can't fool me. But baby number 1, he would always get a low-grade fever, a runny nose, and a rash. And I'd be like, wait for it. Oh, there's the tooth. And it was always the triad. And you'll learn what your baby's version of that is. But do not, a higher fever, even if it happens at the same time as teething, is probably a virus. But a low-grade fever is kind of, we all know it happens, even though technically the textbooks say it doesn't.
So I have to ask a question.
Yes, please.
You said you wouldn't get derailed, so I'm going to test you. So I always tell my sleep families, they get confused because they say, I don't see anything cutting through, the gums don't look unusual. And I say, well, some babies like mine seem to suffer even when the teeth are just like migrating, kind of shifting within the gums. The more sensitive babies. Would you back that up, or am I sharing misinformation?
Well, I mean, I don't think that it's the cutting through the gums alone that's the discomfort. The type of pain that they're typically experiencing is a filling pressure sort of pain. We call that, it's C fiber pain if you go down the pain pathways. It's dull and achy. That's why it's really miserable. And it's probably from those cells proliferating and the tooth becoming bigger in the gums, and then also the tooth, the root of it, elongating so it gets pushed up. And that is a process. Like, that doesn't happen like that. It's a relief when they finally push through the gums, because you know it's done. So kids who feel the buildup, I feel that it's unfortunate, because you're not going to get 2 days and relief. You're probably in it for a week or two. And I do see that more with molars, because those are just big suckers. They're just enormous teeth. So yeah, it's a truth. But if you see this and you're like, my kid is in pain, I stand by it is pain. Now, it's the soothing. This is definitely one of those, well, probably one of the 7 million reasons that it's really helpful to have some sort of soft baby carrier. Because if your baby needs soothing, rather than like putting a sugar water liquid in their mouth to soothe them, like that's where just like putting them in the baby carrier and that skin to skin, at least you will have your hands free, and you know, like that's also extremely soothing for most babies. So, okay, good. Did not derail me too far on that one. Does anybody else have, before they have teeth, this is also the area of like nursing or early bottle choices, anybody making decisions in that category, or had some like memories that are like, hey, I'd like to ask a question about that?
I have a question.
Please.
When is like a normal range for when you're gonna first see teeth?
Sure, absolutely. So that I should have said that. That's a very good question. The textbook answer is 6 months. Okay, but babies don't read the textbook. So if you have a baby who shows up with teeth at 3 months and you are nursing, it's going to be okay, but it's scary. If you have a baby who doesn't show up teeth until 9, 10 months, you're going to be reliving my life, which is my husband once a week saying, are you going to take an x-ray? And me saying, I'm not going to make a baby denture. So nope, not taking an x-ray. They will come. So it's a huge range, and all of them still have very healthy teeth. If they come really early, they're still good and healthy. And if they come really late, they're still good and healthy. But 6 months is the textbook answer on that one.
My son didn't come until 10 months, and I was like,
he's fine. It's technically better, right? Because when they're infants and newborns, they have a high frequency of feeding. And that high frequency of feeding could potentially cause cavities if you have a lot of teeth in the mouth. Like if you had teeth at 3 months old and had like all 8 of them by 6 months, but you're still on regular frequency of milk, yeah, you'd have to add hygiene routine, and you'd have to modify things to accommodate that. And it doesn't mean that they will get cavities. It just means that you have to do more than lucky Amelia and me, whose babies decided to hold off until 10 months. A word of if, and this one's for Rachel, if you are planning on nursing, teeth are one of those things that change up the nursing journey, and definitely like touch base with the lactation consultant on this one and see if this works for you. But when they get their teeth, or when they're teething, really, they bite everything. They will bite you. And so you have to mentally like be prepared for it. And there are 2 things you need to know. Number 1, don't pull, because that will damage you. You snuggle in, and then they will release. And 2, you're actually, even little babies, we are teaching them skills. And so you need to teach them mom is not for biting, teethers are for biting. And so when they do that, you have to hand the teether at that time. And not everybody has that really special experience, but I'm still traumatized by it. So I always mention that so that you're prepared instead of panicked if it were to happen. I see, Erica, looks like you went through the ranks on that one too, huh?
Wait, I literally threw my son on the floor. That's not the right thing to do.
Oh no!
If he were to tell the story, he would say that I threw him across the room, which is not true. I just firmly placed him on the floor. But he's heard me tell the story a bunch of times. So now it has morphed into my mom threw me across the room because I bit.
Yeah, the mythology of that is phenomenal. He needs that.
It's pretty phenomenal. He's 11 and he's a great storyteller. So 11 and a half, I'll be fair. Yeah, that was a little shocking. And I always tell parents, like, if they're really actively nursing, their tongue is going to cover the teeth. So he would only do it really, like, if I could catch him coming off before he was done and playing around, I could prevent that. But I wasn't always paying attention, or I didn't always catch it.
Yes.
He was no longer actively eating at that point.
Absolutely.
Actually, only bit me. I only got bit one time, and it wasn't so like terrifying. And it was just as he was drifting off to sleep. So I do feel like sometimes people are like, it's gonna be scary. They're gonna bite you, but they don't always bite you.
Well, also like that actively. So he was drifting off to sleep because that is how we all are supposed to sleep. Like, we are supposed to sleep with our mouth closed. And so he was going into that normal swallow pattern, which is a different swallow pattern from eating. So that kind of makes sense. And you live to tell the tale. Good. All right. So that is my before they have teeth segment. I'm going to talk next about first teeth. And so in this category, I have intro to solids, I have bottles and cups, and then I will get the brushing in this category. So the reason I like to talk about intro to solids is it's changed a lot. To put in perspective, I have a 5-year-old and I have a 21-month-old. And when I went into the pediatrician with my 21-month-old when she was 3 months old, she says, well, how did you introduce solids to your son? And I very proudly tell her that I, did one at a time. I started with vegetables. I pureed them myself. And she goes, it's very old fashioned. Womp womp. But so this is the conversation about baby-led weaning. Now, baby-led weaning is phenomenal for muscle development. It is great if you yourself are eating great foods and you want to develop an intuitive eater, and I really like it. But I also want you to feel very prepared and empowered by it. And you can also cafeteria it a little bit. But so little pieces on baby-led weaning that I would like you to know. As a dentist, I love baby-led weaning because it does not let babies develop lazy muscles. And the most important muscle in my little world is the tongue. The tongue is so strong. It is responsible for developing the entire face. If you don't have the tongue hitting the roof of your mouth with every swallow, the top bone doesn't get all the signals to grow the way it's supposed to grow. And this translates to all of the conversations about infant tongue tie. This translates to the whole nasal hygiene one, but really food matters. And so some kids are a little bit lazier, like my son. He really doesn't like chicken because it takes a lot of chewing. And I'm like, there you go. And you just have to be aware that the texture of the food does matter, and don't fall deep into the puree trap and overlook a child that needs the muscular development. Now, on the flip side of that, I don't know if you've noticed, I have no absolutes. I really don't. And so if you're thinking about purees, I always want them to work for you. Here's what I mean by that. If you're going to the park, you're probably not always packing a picnic blanket and a gourmet baby-led meal for your little one. Sometimes you're probably going to want to pack applesauce like the other ones. And so what I've sort of compromised in that space and what really worked for me, and so I'm offering this up as an idea, I buy the packs that are vegetable only. What I mean by vegetable only, when you read them, if they say veggie, don't believe that. It doesn't actually mean it's just veggies in there. Apples, pears are really lovely natural sweeteners. And so it does sweeten those purees. When I say I buy packs that are veggie only, I'm talking about I think it's the Hello brand, Hello Baby or Happy Baby, one or the other. It's been a couple months since I bought packs, but it has chickpeas and broccoli and tomato paste. Like, this is savory stuff. I personally don't buy the ones with meat, but that's just because the idea of pureed meat doesn't appeal to me personally, and I try and feed kids things that I would be willing to eat myself. But these veggie packs, if you go savory on those These are vegetables that they might have missed that day, and so you can dollop it on. Everybody else is giving their kid a pack of applesauce, and you're adding a vegetable, something that's serving you. It's a series of things that you really wanted them to eat anyway. And it's a nice way to bind foods together. So if you're trying to get them to eat something chunkier, like farro is a big hit in my family, and it's nice and chewy and has a nutty texture to it. But farro without something binding it in some way, like plain yogurt or one of these veggie packs, doesn't always make it all the way into the mouth. It might mostly be a projectile on the floor. And so that's sort of my backup use of the purees as kids get a little bigger. So yes, baby-led weaning, but if you're going to go for purees, I like the veggie ones so they don't develop too much of a sweet tooth, because it's very easy to get a kid to eat small chopped up pears. They're delicious. You don't have to coax them into that. It's harder to get them to accept the other flavors, and you definitely want them to have them introduced many, many ways. So I find that to be useful and helpful when it comes to that. The other part about baby-led weaning that I really encourage families to do is there's this conversation about you should, take a baby CPR course before you have a little one. And this is really helpful when they're starting to eat their first solids, because they, up until the point where they start consuming solids, they have spent their entire lives pushing their tongue forward. That's how you get milk. If you're nursing, it's like this motion. And if it's a bottle, it's this motion, but it's still a forward tongue motion. And that's why the very first time you give them food, maybe a puree and a spoon, they're going to spit it out. And everybody says, oh, you hated your first food. No, they didn't dislike it at all. They literally didn't know how to eat it. And they pushed it out just like they do the milk. And it's a good mess. I don't recommend beets as a first food because I promise you'll wear it. I do recommend it when your mother-in-law is babysitting, because that's a really funny diaper. She still speaks to me. It's fine. But those are the things to know. Just the tongue pushing forward has to learn to come back. So here's why CPR is really important. Along that process, the child's also learning to coordinate it back and bring it back as a bolus of food. And if they were to have that coughing, choking episode, I want you to feel confident. And the way you can feel confident is not just the CPR course, but rather do a really silly, fun baby choking drill. I know that sounds crazy, but don't you think your baby would really love it if you picked them up playfully, not when they're eating, and you flipped them over and you did a tap, 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 and then you flipped them over and did a tap, tap, tap? I think they'd love it. I think they would think that was the most ridiculous, silly game, but you would get a good feel for the weight of your baby. So that if you ever had an emergency, you would have great confidence. You're like, oh, this is the angle. Because the first time you do this sort of movement, it's a little bit awkward. But if you've already played with your baby and done it that way, I feel like it really takes the stress out of it. And I have done baby CPR, not like just choking, right? I've done it twice. Cauliflower, that was a surprise. And we had roses in the house, and someone walked by with the vase and one of the leaves fell on my kiddo's bouncer and she got that in her mouth. Yeah, so it happens. And so it is one of the best ways to just know it's going to be okay is build up your skills and confidence in play.
And we have another resource in our village, Mainline Family Education, and they offer a virtual, at the moment, virtual CPR, but once their studio opens, they're going to have the virtual families come in person and finish up their practice. So
awesome.
But there's a local resource near everybody, but that's a good one.
Yeah, very good. So I always say playful things, playful safety things are really important for kids in general. We do boring fire drills so that my kid doesn't get used to thinking that's a lot of fun, but like it's good to do play for safety. All right, so moving muscles, spoon technique. This is one of those that an occupational therapist really opened my eyes to. So in addition to learning to go from sticking your tongue out to pulling a bolus of food back, you actually have to learn to coordinate your lip muscles to use a spoon. And so we all look at babies being fed with a spoon and we help them sweep the spoon up on the lip. And the first few times it's fine. because it's going to be a mess otherwise. They're learning a lot of other things. But eventually you have to intentionally realize that you need to teach this lip to come down. And so try putting the spoon in and out without the sweep so that they learn to curl their lip down. This is strength also. And sometimes you'll see people with a really short lip and a really gummy smile, and it might be related to underdeveloping that muscle. Muscles are amazingly important in how our faces end up. So doing those little things and coaching those will save you some stressors later in life, if possible. So that's what I have on my solids. I'm going to go to bottles and cups next, unless anybody has any question or good anecdote there. 3, 2, alrighty. Bottles and cups. Okay, so number one, let's talk about if you are using a bottle, the party line is to stop using a bottle at age 1. Now, when I say the party line, I'm also saying that there are a lot of things happening at that first birthday. So it could be before that, it could be after that, but just have it in mind that that's the ballpark. And there's a reason for this ballpark. One, this is a time where you really want to make sure that they're not associating that bottle with sleep and going to sleep with the bottle, because they have teeth. And this is really going to burn through their gorgeous, brand new, super healthy, pearly baby teeth. So there's a little bit of that reason for quitting. There's also that muscle development, because the babies at that age, they have the ability, if you teach them to use a cup, and you want to teach them away from the sticking out tongue position and start pulling things back. And so the bottle is just perpetuating that at age 1 when they really need to learn the other skill. But the thing that I throw out there are a lot of changes happening at age 1, because a lot of families at age 1 also are transitioning to cow's milk. And you do not want to try and do this transition from breast milk or formula to cow's milk and the bottle in the same week. It's a lot of change. I find it, I always compare my 2 kids because they have nothing in common. They were such different babies. My oldest, he was a breastfed baby, 13 months. And I mean, he didn't even look back twice when we took the bottle away. And he chugged cow's milk as long as we warmed it, right? Like, never gave me a trouble. And he still does. He drinks a lot of milk. Baby number 2, different journey. That was a COVID baby. So I nursed for 6 months, went back to work, and I dried up within a week. I mean, work was really stressful, and lactation just doesn't work great when you're that stressed and dehydrated. So she ended up having 6 months of formula. And then when I transitioned her to cow's milk, oh my God, it hurt that poor baby's belly so much. It was tough. So we really dialed it back and had to ask ourselves, what are we doing here? And for some families, I say, do you drink milk? And they're like, no, I don't drink milk. And I'm like, well, then why do you need your baby to drink milk? Let's figure out other ways for them to get the calcium that you're looking for. And we find other ways. I drink milk. My husband drinks milk. My son drinks milk. So I want my baby to drink milk because I want her to eat what we're eating. So I dialed it back. And I started doing like a quarter cow's milk, 3/4 formula. And I had to, it took me a month until I could give her a full cup of cow's milk without hurting her tummy. And she's fine now. But the reason I bring that up is both of those journeys are fine, right? You just need to be prepared for it, know it's coming, and know what's important to you personally. And that's one of those things that comes up really routinely in first dental visits with my families in office, because when we get down to it, everything I'm keying into is children should eat like they're grown-ups. And we have a lot of expectations of what our kids should be doing. And if we can stick to that, it's really helpful. Because if we eat this thing that we want them to eat, they're more likely to believe us that we should be eating it. But if you say that broccoli right there, you should eat it, but I don't, they'll be like, haha, fooled me. It's bitter. That's poison. So those are sort of helpful insights to some of my nutritional counseling in office. So that's where I am with the bottle. I have one family last week that I wanted to just throw out there, just how variable this advice can be. They have a 2-year-old that was still using a bottle. And to that family, I understood, and she's like, this is for comfort. And it's like, all right, this is what we're doing. Then she needed time to add those other associations, like I had said with the little ones and pacifiers and thumb sucking. She needed to add a lot of other associations. So I said, okay, work on adding those associations. But in the meantime, I want you to give yourself a deadline that that bottle no longer contains milk. So if you're going to put them to bed with the bottle, let's get it into a water bottle. And that's also easier to quit because children find that less gratifying. But let's just 25, 50%, 75%, 100% by the end of this month, that is a bottle full of water. I can live with that. I don't know any college student that is drinking a baby bottle of water going to college. They will wean themselves if you could just get through that. But it's a gentler way to say, all right, quit that bottle, even though I'm saying you need to quit that bottle. So helpful things on bottles. Let's talk cups. There are so many sippy cups in the market, and there's a lot of opinions, strong opinions out there. And so I think that the majority of us would probably be best served with this version. And that is, sippy cups are helpful, but they are not a developmental milestone. And so what I mean by that is that you don't need to spend hours. I think my computer tried to just like update itself. No, I do not want to. Am I still here? We're still good?
Still look good on my end, yeah.
Sorry about that. Okay, that derailed me. So sippy cups are not a developmental milestone. They are an invention that is meant to help us. And there's nothing wrong with innovation. So I'm not knocking on that. They also save our carpets, right? Because we can't always give a 6-month-old a cup of milk and be okay with it being thrown everywhere. So sippy cups really do help. But the skill is an open cup. And so when you're introducing sippy cups, also introduce open cups. My favorite way to do that is use the medicine cup from like that baby Tylenol and fill it less than halfway with a little sip of water. And you're going to find this is a delightful game for your baby. And they really do take to the skill. And there's this like special like inflection point in any cup. It doesn't matter the size. If you go past that 1/4 to 1/3, it suddenly becomes more gratifying to spill it. So you really want to have very little liquid in this cup and teach them to tip it all the way back. They're more likely to drink that. Once you get to like a half full cup, they're far more likely to throw it on their brother. So there's no less skill if there's less liquid in there. And I would rather get up and refill a cup than get up to clean it off of the floor. So just sort of a parenting hack right there. But the medicine cups work really nicely for that. I may or may not have repurposed all of the shot glasses from my youth. And glass is an issue, but if you're using glass bottles and that's a thing for you, like these are glass containers, but they're also like the perfect size for my little one to easily like pick up, and they're weighted. So they give them that nice feedback when you put it down, it makes a sound and it doesn't tip itself. I don't do it unsupervised because obviously it could be flung across the room, but it is a use, and it also makes me chuckle because it does say Commonwealth Cider Company on it and all the other cool things I used to do before being a mom. You'll get back to them. It happens. Babysitters are amazing. Okay, so that's what I have on sippy cups. Now you're going to ask me, which is the best sippy cup? I actually don't have really strong opinions for most children on this. And what I mean by that is, if your child is developing good muscle control and strength from chewing really challenging foods, you probably don't need to worry about your sippy cup. If you have a kiddo who is, then there's the conversation of like the easy peasy cup is probably technically the best. It has like an indented lid and an opening. It's basically an open cup. It is definitely going to spill water, but a lot less water than if you gave them just an open cup. People like to talk about straw cups, as long as it's a fixed straw. You don't want the kid being able to like impale themselves down on it or pull it all the way out and have something a lot sharper. I I use 360 cups because really you can sling those the furthest and spill the least. That's it. That's the real reason I use it. Not because it's developmentally better in one way or the other. It just spills less. But I also use open cups, and my kids did not have any challenges to muscles in those areas. So hopefully you find that useful and soothing in a world where everybody is telling you beware. I would say just be aware. So bottles, cups. Hey, you want to talk brushing? I told you I'd finally get there. Toothbrushing babies is like one of my favorite things. I find it a really entertaining part of my nighttime routine. And I love coaching families through it, especially when they're like, you're not getting in there. And I'm like, it's actually my full-time job. We're getting in there, but we're going to make sure you can get in there too. So what I like to do is include it as part of their bedtime routine. And the reason I do that is children love that bedtime routine. Trust me, like they say they're the two most important times of a child's day is when they go to bed and when they wake up. And especially as a working mom, like I have anchored deep into those because for me, I need that as much as they do. So bedtime routine, it gets you through the second child, and it is what I look forward to in the day. And it's when my kiddo tells me everything, but I set it up as an infant. I have been giving him a bath, reading him a book, and brushing his teeth and putting him to bed in that order since he was a little baby. And we went through phases of what that looked like where, yeah, it was a struggle bus at first. And I used to have to wrap him in a towel after his bath. So he was a baby burrito so I could get in there. And then it got to a point where he would crawl over and like plop himself on my lap because he knew it was part of the routine. And now I sit on the toilet in the bathroom and he backs into me and he looks up and I brush his teeth. And so the habit and the routine is what makes this successful and much less stressful. So if you can set it up really early, you will be happier, even if they're a wiggle worm. The wiggle worm tricks, wrap in a towel. So they're a baby burrito. My husband's hack on that one is, I always do this sitting, by the way. Don't try and stand. Don't look at the little one. Sit down on the floor so you can't drop them and lay them on your legs with their head towards your torso, and you're brushing them from behind. This is a great position of control. You're not going to hurt them if you can control the head. If you're following them around, there's likely to be an injury at some point, and then they would have a justified reason to be annoyed with toothbrushing. But if you control the head safely, you can also get a better look in there. You can lift the lip up and brush those front teeth. They're really good looking ones. So anyway, from behind is the key for toothbrushing. My husband puts the arms underneath the knees, lays the baby down on his legs, arms under the knees. I still baby burrito it because that's just my favorite, but these two variations work really well. And do this when your baby is 6 months old so that when they are 18 months old, they're crawling towards you, they're not running away from you. Really helpful things. I know which families brush their kids' teeth because there is this change in our appointment where I lean them back for our lap exam and I bring out the toothbrush, and the kiddos who regularly get their teeth brushed, they open. Now, I'm not saying they open right away, but like I brush a little bit and they give up because they know what's going to happen. The ones who are still winning the battle at home, oh, it takes them a whole 30 seconds to give up, but they do give up. That's the point. They're really fine with it. This is not traumatizing. We all wipe our baby's butts, right? Like we would never let them get diaper rash from that. So we definitely are going to brush our baby's teeth because we would not want them to get gingivitis or cavities from that. So sort of along those lines, really helpful to come in early if you're struggling with it. What do we brush with? As soon as they have teeth, I recommend a smear, little grain of rice, tiny little bit of fluoridated toothpaste, okay? And so I would like to go on a little tangent. What is training toothpaste exactly? Shouldn't we be training ourselves to do exactly what we're supposed to do when we're actually racing? Right, so training toothpaste is infant toothpaste that has no fluoride in it, so it's safe to swallow. So what you see people do is they put this on the toothbrush to teach the child to eat the toothpaste. And I'm like, I don't think that means what you think that means. So like take that training toothpaste and just put that in the garbage. It has no function for you because it is not training anything, unless you are specifically using it to freshen the breath. And then that's fine. because it's working for you. Okay. Amelia.
Yeah, because I was like kind of horrified. I got Asher, like it was like a little, he likes Elmo. So there was a little Elmo toothbrush. It was the first that I got, and it came with that training toothpaste. And I was like, what is this? And when I read the back, there was xylitol in it, which is like poisonous to dogs. And I was like, that seems horrifying. I don't want my baby to have this. Let's get rid of this. And also, like, we had a dog in our house. So I was like, this needs to go in the dumpster far away. So I was like, no, this can't be in our house.
Well, I think the dog comment is really important. And I think that I would mention that to more people, knowing that as it is. Xylitol, I do want to suggest, like, there are many artificial sweeteners out there. Dentally, xylitol is my favorite. It has a special way of getting into the metabolism of the bacteria that causes cavities, and it slows down the metabolism. So not only does it not cause cavities because it's not a real sugar, but it also fights a little bit. And it's in Trident gum, which is my favorite for teenagers who have picked up a soda habit or a snacking habit and are starting to get cavities. I'm like, oh, well, you can't snack if you're already chewing gum. And so I throw that in there. But for a dog family, I think I would be really worried about that. And there are probably more toothpaste than you realize that have xylitol, but the ones that don't have xylitol, they typically have aspartame instead, which is not my favorite artificial sweetener either. I will I have a pamphlet in a drive. I will see if I have one that lists a toothpaste that has a different artificial sweetener that might work better for you. So if you pop me an email, I will remember to respond.
Yeah, thank you. Because I didn't know a whole lot about, like, I had never really thought about what was in my toothpaste, which I guess, like, whatever.
Well, what's in yours, I wonder?
Yeah, right. Like, I wasn't really sure. So then I was reading his and I was like, oh no.
Yeah. Yeah, check yours. I don't know if yours would have xylitol either. I mean, there's just a lot out there. But here's what I'm going to go down that rabbit hole. I like it when kids use their parents' toothpaste. Unless you're using a really super specialized prescription fluoride toothpaste, like, kids should use their parents' fluoride toothpaste. And sometimes kids are going to be like, oh, that's spicy, but they're going to accommodate to unusual flavors. Just like they're eating the broccoli you're eating, they shouldn't have just like fruit punch toothpaste, right? They should have all the flavors. And so here's where it's safe. Grain of rice is a tiny amount, and they're obviously not spitting at 3 months old. They're not. They're probably not going to spit reliably until they're somewhere between 3 and 4 years old. And so that grain of rice twice a day, assuming they consume all of it, is still less fluoride than what I could write as a prescription strength vitamin. So, like, it's less than I would have intentionally even given them. And if they're using that toothpaste, it's actually doing the job that you're hoping, which is hardening the surface of the brand new teeth. I don't need it to harden other things in their body. I just want it to touch the teeth. So if you do that little brushing, most of it stays on the toothbrush because it's just a smear. And that little extra you could wipe off with a washcloth. You're not trying to get them to swallow a ton of it, but it would be safe if they would do so. I up to the pea size, which is still less toothpaste than they show you on the commercials. I still only use a pea size myself. You don't need to use that much toothpaste. But that pea size, I do at about 4 years old, 3 years old, when I've taught them to spit. And my favorite way to teach a child to spit, that it doesn't end up all over the mirror, is to tell them to say "to," the word "to." And that manages to get it mostly into the sink. I had an occupational therapist that suggested that once and said, put a latex decal of the number 2 in your sink. I'm like, that's fancy. I like that. I didn't do that. I just say 2. But if that's your thing and you really enjoy those Pinterest opportunities, the latex decal in the sink will cue them to remember to say 2. And you will probably have someone spit very young. You can teach a 2-year-old to spit. They have the ability to do so. They just don't have the impulse control to do it reliably. And that's fine also. So that's my little bit on toothbrushing, how to get it done.
About the babies who get the teeth at 3-4 months, are we using an actual toothbrush at that time, or are we using a washcloth with something on it?
Yeah, if they have teeth, I would use a toothbrush.
Okay.
So I mean, even the littlest babies, like you have to think about like, what are you worried about in using a toothbrush? You're worried about hurting them potentially, right? But you won't. You will not hurt a baby if you are very carefully from behind their head controlling everything. And when they're really little, I put my finger in between their gums, right, to give a little bit of space. So they're gumming my finger when I'm brushing those two precious little front teeth down there. They're not going to get hurt on that toothbrush. And you don't have to vigorously scrub. You're just going A, B, C. Oh, you don't even have enough teeth for the whole alphabet. I usually do sing ABCs when I brush teeth. And I do this because I'm trying to classically condition my child. I want them to know, one, there's a social contract here. Even little babies know this ends at Z. They know this song. And so they're more likely to accept something for a short period of time. It's called contingency, right? They know it's coming. And so I also want this built in and conditioned for something easy like toothbrushing, so that when I have to remove a splinter, I can use the same song. Or, you know, maybe it's cutting fingernails. I mean, I found cutting nails on my son was super easy. I would always do it when I was nursing, but cutting nails on my daughter was impossible because she wasn't nursing. And so it didn't have that like stabilized period of time that she was holding still. So I had to rely on ABCs with her a lot more in order to be able to cut the nails. So I also use it in office. So if you classically condition your child for ABCs, your child will respond to me singing the ABCs, and it calms them down. It's baby meditation. So I do definitely encourage you add that to your routine. I am looking at the time. I do this all the time. I always run super long. I have the option of talking about the first dental visit in our little bit of time left, or I could go and talk about nutrition and oral health, which is my particular joy space. Does anybody have a preference? All right, well, I'm going to make myself happy then. Let's do nutrition. Oh, I see both. Okay. Well, I'll try and get to both. I know we're going to hit the 9 o'clock, so I definitely don't mind staying a little bit later. But let's talk a little bit about nutrition. So what I would say, once we get past purees and bottles and all of those things, when we think about teeth and what nutrition has to do with teeth, the teeth don't really care how much sugar they get. I know sugar causes cavities, so you want to cut down sugar and then you won't get cavities. It's not really how much, it's how often. Okay. And I tell you this so that you can be confident in developing a healthy relationship with food, because you do not want to have kids who are like never being told, no sweets. And then suddenly when they have their own choices are binging it, right? Like you want to have a healthy relationship. And so if you know the how often is more important than how much, you can shift some of these choices. So I am a dentist. My kids have dessert every night. I love dessert. They are eating the way I eat. They should eat like they're grown-ups. So it would be really wrong for me to eat dessert and not have them have dessert. And so what I mean by this, as my children have dessert every night, is that I don't have frequent carb consumption. I pushed dinner, which has carbs in it, and dessert, which definitely has carbs and sugars in it, together. And so it counts as one. It's not two. Okay. And so that's why you don't want to encourage carb snacks as much. You want to push things into meals. And once you get into that 1-year-old age group, now we're hitting parenting goals here. A 1-year-old is flipping the switch from being predominantly milk nutrition, food is recreational, is skill building. And now at 1-year-old, you're flipping over to food is nutrition and milk is the supplement. And now we start grouping those meals together. Instead of on-demand feeding, you might see somebody at the end of that, 1 to 2-year-old phase eating breakfast, lunch, dinner, and 1 to 2 high quality snacks. And a high quality snack might be milk still. A high quality snack in my book is a cheese stick and a piece of fruit. And the other snack, if your first one is a high quality snack, can be what you want it to be, right? So maybe that's something that is really convenient in a bag like Cheerios or animal crackers. Oh, that has sugar in it. Yes, but it's not high frequency. It's not all the time on demand. It was a discrete snack. Some sneaky ways that carbs become, more frequent. Juice. Kids who sip juice tend to have cavity, and it's because they're sipping it. There's a longer duration. It's very sweet. It stays on the teeth a little bit longer. And they usually have like 1 or 2 in the day, and it replaces the water that they really needed to be drinking. So I would suggest you treat juice like soda. And what that means is my kid knows he can order chocolate milk or juice if we're at a restaurant. I'm never going to say no because he's sitting there, he's behaving, and that's a special treat. My kiddo knows at birthday parties, oh yeah, he doesn't even have to worry about me looking at the juice box. He goes, Mom, I had 2 juice boxes. And I was like, you go have a third. Because it's a special occasion. Special occasions are not causing cavities in your kid's mouth. It's just not a problem. But I don't really keep juice at home. I tend to keep like a Pedialyte in case there's a stomach bug, but I don't drink it myself. So I don't give it to my little ones. I just keep it as a special occasion thing. So juice is a sneaky one. There are some sweets that I prefer. So there's a book out there, which is Eat More Chocolate, Get Less Cavities. It's sort of a funny tagline, right? But chocolate doesn't typically cause cavities because it's something you eat discreetly and it melts right off of the teeth. But here's what does. Gummy, sticky, sour. I sometimes joke with my dental assistants that these are my job security. If they didn't exist, I probably wouldn't have very many cavities to fill. Juice and gummies, right? Like they really seal the deal for me. So I'm offering this information to you free of charge early enough that maybe you could make some different decisions. So gummy vitamins fall into this category. If you could choose like a chewable Flintstones instead, you're going to be a lot happier. If your kiddo is so picky that gummy vitamins are the only option, give them before breakfast, feed them breakfast, brush teeth after breakfast. Okay, it didn't happen as far as I'm concerned. But the most harmful option is giving them a bag of fruit snacks as their afternoon snack, right? Like that not only is not a high quality snack that's getting something into their tummies that they couldn't fit in their meals, but that sugar is going to stick on their teeth probably almost until dinner time. So it doesn't count as one, it counts as 1, 2, 3, 4, however long that gummy is stuck in their teeth, that's how many snacks it counts as. And that's why it tends to cause cavities. Lollipops are sort of along those lines. You suck on them for a while. So it's a long duration. So you start counting it as more than one as far as the teeth are concerned. So Halloween's coming up. And so what happens in my household on Halloween is my kid goes trick-or-treating and has at it on Halloween. And then in the middle of the night, the gummy sticky sours disappear. And there's so many other candies in that bag. He does not even notice. And if you can develop a preference for the ones that you find healthier and more acceptable, then they won't really crave. Kids tend to go down 2 roads, the ones that really crave the sour and the ones who enjoy chocolate. And you want to try and see if you can train the preference to something that's going to be less harmful. So keep the sweets as dessert, avoid the gummy sticky sours. And remember, teeth don't really mind how much sugar they're getting. They only care how often. So push things together into meals. I hope you found that interesting and helpful, talking about the purposes of snacks. I talked about the milk transitions and eating chocolate. Okay, so did you enjoy the nutrition part of that? Cool. First dental visit. I will go a little brief on this one. We recommend it between the eruption of the first tooth and the first birthday. Why? Well, today is a great reason why. Look at all of these things that I can offer to talk to you about. And there's a lot more, and it really depends on where you are with your journey, what's happening with your kids at home. And these are very personalized visits. This visit is not a 5-minute visit. I actually schedule an hour for my babies, my new patient babies, because there's so much to cover. And I know if I put my time in now, you're always going to be a healthy visit. You're not going to have cavities. You're not going to have unhealthy teeth, mouths are going to develop. You're going to be very happy. At that first dental visit, I talk about nutrition. I talk about sleep habits. I coach you through toothbrushing. I spend a good amount of time training if that's what you need for it. I talk about the things coming up in the next 3 to 6 months that might be the next milestones to keep in mind. I talk about trauma. I didn't mention that one here, but I always want you to be prepared for a little bit of dental first aid and what to do. And I have a series of, oh, Amelia looks like she survived this recently. So just having a little bit of stuff on hand, and then knowing, like, just take a quick picture, snap it to me. We're going to get you through this, and I'll probably keep you out of the emergency room. These visits are really important in setting a routine. So a 6-month-old or a 1-year-old visit, yeah, it's usually a little bit loud. But by 2 years old, with the frequency and returning back, these kiddos hop into the chair. They're giving me a high five. They have a lovely relationship with the dentist. I just had one come into the office today. His first visit was at 2.5, and he's nearly 3. He was amazing today. And that's all it takes. It just takes that a little bit of familiarity where he goes, oh yeah, I know where I am. I know who you are, to build a lifelong, happy, wonderful relationship. Oh, gotcha. Yeah, toddlers fall. I will say this about toddlers. My 5-year-old, he has been making it his full-time job trying to knock out his front teeth ever since he got them, and he has not succeeded yet. But so my trauma first aid things that I want you to have on hand. Number 1, if your kid falls, when your kid falls and it's bleeding and upsetting looking, don't look at it right away. I want you to wrap them in a blanket or towel, and I want you to hug them until they stop bleeding, because crying babies, they keep bleeding. Calm babies, they stop bleeding. Okay, so number 1, don't even look at it, just get them to stop crying. I say the towel so you can hug them without worrying about your shirt, because that's actually, like, they think something's wrong if you're not holding them tight. So just like wrap them, it's going to be fine. Number 2, keep Pedialyte ice pops in your freezer. The reason specifically Pedialyte is because I live in a city home. I don't have room to store things that don't have multiple uses. This is good for a stomach bug, but it's also the best ice pop, right? Because most kids are not going to hold an ice pack on their lip, but they will suck on one of these for 20 minutes. Swelling's down, bleeding stops, pain is reduced, we're good. At that point in time, you're going to snap a picture of it and you're going to send it to me, because that's when we can make a good decision. Don't go to the emergency room first, because it's just a long wait. So those usually can keep the emergencies down. So I hope you found this really helpful. I like to share a little bit about my practice. And one of the most important things, if you remember nothing else about me, please remember my passion for nutrition. This translates into my practice. We have an amazing relationship, a community partnership with the Food Trust. You might know this organization from fun things like the night market, but they do a lot of youth-facing nutrition programming in the city. They go into preschools and talk about, healthy snacks. We're doing that this month and sending preschoolers home with bags of apples for their families. But they also bring farmers markets into communities that don't have fresh grocery stores. They augment families' ability to buy fresh, healthy foods. And we're working together with them this year to also build community vegetable gardens in schools, to build some green space for schools that don't have that for their kiddos. And so every new patient visit at my office, we are donating 10% of the proceeds to the Food Trust. I have my first donation check coming up this month. We're able to donate over $1,000 for my first quarter as a startup business. And so that's my joy space. That's what we're doing. So if you enjoy that, just follow me on Facebook or Instagram, share the message on that. It's really important to us.
That's awesome. I love that, Dr. Maria. Megan, I don't know if you're still looking at the chat, but Megan has a question if you want to take a peek. And yes, I can.
Okay.
As long as this recording converts like it's supposed to later, I can share the recording in an email to everyone that was here.
Yeah. So the question is, my older kids went to the dentist first time at age 2, and their visits are always 10 minutes. Should I find another? So I think that if it's working for you and you feel satisfied, no, don't change. You're probably in good hands. But here's my first visit is an hour. My subsequent ones could be 10 minutes, because I spent the time the first time. And if a lot hasn't changed or we covered all the ground, but if you find that your questions aren't being answered, that's what we can seek as parents. I think that there's a variety of providers out there, And I have lots of questions. I always pick my providers based on like, can you answer my questions? Or if you can't answer it, do you try to? Do you try and find it for me? And this is personally very important to me. And I'm bringing that to the table as a mom, and I brought that to the table as a provider. And so I think that if your kids are happy and well at their dentist and you like their dentist, don't worry about the time scale of it. But if you have more questions, that's what you're seeking. And then I would encourage you to find someone who can answer them.
Awesome. Wonderful. Well, wow. I thought I was pretty informed, but this was super, super helpful and awesome. Thank you so much for your time. And congrats on your joy venture, I think we'll call it.
Yeah.
Awesome. Just remind everybody where they can find you in all of the places, in the real world and in the social world.
Absolutely. So my practice is located in the Art Museum neighborhood. It is Philadelphia Pediatric Dentistry. Our website is phillypediatricdental.com. I will pop that into the chat menu there. And I spend a good amount of time on Facebook and Instagram trying to just build useful content. So you could follow me at Philly Pediatric Dentistry on either one of those.
Awesome.
So I hope to see you.
Yeah, and we didn't talk about this tonight, but I just saw your post that you're doing lasering tethered oral tissues for families that have referrals, and it's always good to have extra resources for that.
Yeah, thank you. That's definitely a give back. I spent so much time at Solutions for Women taking care of number 2, and I'm really grateful to be able to give back that level of support that I was given.
Awesome. Wonderful. Well, thank you everybody that was able to join. I will do my best to get this recording to you. And thank you to Dr. Maria for taking the time. And perhaps we'll try to do a daytime one for anybody that was too sleepy to join tonight. But thanks for trying to keep it on time too.
Yeah, my pleasure. Have a good evening, ladies. And anybody who has more questions, if you email me in on the website, particularly the toothpaste one, I promise you, I am going to forget if you don't email me, but I will answer you if you do email me. Yeah, happy to follow up and offer what I can.
All right, great. Thank you so much, everybody. Enjoy the rest of your night. Go find Dr. Maria and her practice in all the places. And thank you again for your time.
Thank you.
Good night.
And congrats, Rachel. Enjoy your growing family.
Thank you.
Congratulations.
Bye.
Bye.